Okay, so we are talking about the blood. In last class, we have talked about the plasma part of the blood, which is the liquid part, and we have talked about the plasma proteins, different types of plasma proteins, albumins, globulins, fibrinogens, or fibrinogens, and their functions. Today, we will start the formed elements. Formed elements are the blood cells. Three different types of cells are found in the blood: red blood cells, white blood cells, and platelets. Today, first we'll talk about the red blood cells. Red blood cells are also called erythrocytes. First, we will see the general properties of red blood cells. If you see the red blood cell, the color of red blood cell is red. You have seen the color of red blood cell is red. Why? Because of the presence of hemoglobin. You know that hemoglobin is a red colored pigment present inside the red blood cells, right? So that's why the color of the red blood cell is red. Shape of red blood cell. Red blood cell is like flattened donuts with a big paste center. So you have seen, all of you, the donuts, and the donuts, most of them have holes inside, right? A hole inside. But in case of red blood cell, just remember that there is no hole, but the center part is thin compared to the outer part. Outer part is thick and center part is thin. And inside the red blood cell, if you see inside the red blood cells are non-nucleated. Mature red blood cells don't have any nucleus. Okay? So anucleated, absence of nucleus. And lack of most cellular organelles. Important cellular organelles, for example, mitochondria, ribosomes, those are absent inside the red blood cells. However, as I have already mentioned, inside the red blood cell, you will find red pigments called hemoglobin. Okay? So no nucleus, but hemoglobin is present inside. Advantage of having this special shape. We know that most of the cells in our body are like a round ball, but red blood cells are flat. What's the advantage of having that flat shape? One advantage is flattened shape maximizes surface area for the exchange of oxygen and carbon dioxide. How? Just think that if the red blood cell is round like a ball and hemoglobin is inside, like here, a small ball inside the round big ball, hemoglobin is here, then the distance from the surface of the red blood cell to the hemoglobin is more. If now press the red blood cell like this and make it flat, then the membrane or surface comes very close to the hemoglobin. Make sense? Like if you take the air out from the soccer ball and make it flat, then if you put something inside, it will come very close to the membrane surface. Is it clear? So that's why if I draw here, this is the normal cells in the body. Now see here, from the surface to this, if this is hemoglobin, the distance is more. But actually the red blood cell is flat, like this. So hemoglobin is here like this, and it is very close to the membrane. Okay?
What's the difference between a sickle cell?
Yeah, in that condition, the shape changes. Okay? We'll talk about that later. Yeah. Okay, so that is one advantage, that the membrane comes close to the hemoglobin, and exchange of gas occurs very easily because the gas doesn't need to travel that distance. It is hemoglobin is very close to the membrane. Yes.
So in a mature red blood cells are not nucleated, but are young ones nucleated?
Young, immature red blood cells are nucleated. Yes. We'll see how the nucleus disappears in next slide. Okay. Okay. Another advantage is this special shape allows their passage through narrow capillaries. What happens, since the red blood cells are flat, they can easily get folded. Like a soccer ball again, if it is filled with air, you cannot fold it, right? Now, if you take the air, all the air out, you can easily fold it. So, since the red blood cells are flat, when they try to pass through narrow capillaries, they can easily get, folded and pass through it. So, those are two advantages of having that special shape of red blood cells. One is hemoglobin comes close to the surface membrane, so exchange of gas gets easier. Number two, it can pass through the narrow capillaries easily. Here in this slide, you see the red blood cells. First one, red blood cells under the microscope. Today you have lab, right? Okay, so in today's lab, I will give you a blood smear slide. You'll see under the microscope, you'll see exactly the red blood cells will look like this, okay? So all of these are red blood cells. There are a few platelets here, very tiny. See here. Now, one thing you have probably noticed that the outer part of the cell is darker and center part is lighter. Why is that?
With no oxygen.
Any other? No, actually not. We know that outer part is thicker and center part is thin, right? Now, when we see something under the microscope, what we do? The idea is passing the light from the bottom, right? We pass the light through that structure from the bottom. Now, if the structure is thick, then light will not be able to pass through it, right? So we'll see that area is darker. And if it is very thin, then light will be able to pass through it, that area will look lighter. Make sense? So that's why you see all red blood cells have thick outer part, darker, and center is lighter. Anyway, now if you cut the red blood cell and see, here you see that center part is thin and outer ring is thick, okay? And the measurement is this. You don't need to remember actually what's the, I won't ask you, tell me what's the thickness. Just know that outer part is thick and center part is thin, okay? One important property of red blood cells is formation of roll-up. Roll-up is stack of red blood cells. It's like when you go to have a big, dinner party, probably you have seen, they stack the plates together, right? Pile them together. Red blood cells, since they are flat, they can easily get attached to each other and form stack. And that is called roll-up formation. That property is called roll-up. Roll-up is the stack formed by the red blood cells. Okay, so just remember that name of that property. What is that? Okay, now we'll see the count of red blood cells in the blood. In adult male, in 1 microliter of blood, the count of red blood cell is 4.5 to 6.3 million. Okay, so in 1 microliter of blood in adult male subject, the count is 4.5 to 6.3 million. In adult female, the count is 4.2 to 5.5 million. So, really very high number is in our blood. The number of red blood cells is really very high. Now, why the male blood has more red blood cells than female blood? Anybody?
Men usually have more body mass.
Okay.
Carry more oxygen.
That is one answer is male body needs more oxygen because more muscle, right? Very good. The main reason is the sex hormone, male sex hormone testosterone. It stimulates the bone marrow to produce more red blood cells. Okay, so that's the main reason. The male sex hormone testosterone that stimulates the bone marrow to produce more red blood cells. And number two, as Glenn he has mentioned, that male body usually is more muscular, not always. Right? Yeah, so need more oxygen. That's why the bone marrow produces more red blood cells. So those are the two reasons. Yes. No.
During pregnancy, does the female body make more red blood cells, or does it
During pregnancy, since the female body, late part of pregnancy, female body delivers blood to the fetus. Okay, so yes, the female is carrying extra body. Okay, another body, so it needs more red blood cells. The total count of red blood cells will increase. But remember one thing, that also in female body, due to hormonal changes, fluid part in the body also increases. So if you take a drop of blood and see, the count will not vary a lot, but the total number is more increased. Okay, so those are the two reasons why in male blood the red blood cell count is more. How about children? Small kids, the count of red blood cell is higher. The reason is, in early life, our body grows very fast, right? And a lot of metabolism takes place because body grows. And during the growth, we need a lot of metabolism in our body. So for metabolism, you know that more oxygen is needed. For more metabolism, more oxygen is needed, right? So more red blood cells should be present in the blood to deliver more oxygen. That's why you see in children, the count of red blood cell is high. Okay, formation of red blood cells. The formation, the term hemopoiesis or hematopoiesis. Hemo indicates blood. Remember, hemo indicates blood. So also hemato indicates blood. So hemopoiesis or hematopoiesis. Poiesis means production. So hemo or hemato mean blood, and poiesis means production. So hemopoiesis or hematopoiesis indicates the production of blood. That means the production of blood cells. And blood cells come from hemopoietic stem cells. We know that the stem cells are the cells that can easily proliferate and produce new cells, right? So stem cells can proliferate and produce new cells. And the stem cells, those are responsible for the blood cell formation. Those are called hemopoietic stem cells. Very easy. Hemopoietic indicates, hemo means what? Blood. And poiesis indicates poietic. Poietic or poiesis means production, right? So those stem cells are producing the blood cells. Those are hemopoietic stem cells. Very easy. Okay. Now, erythropoiesis. Erythrocytes are red blood cells, you know that. And poiesis means production. So erythropoiesis is the production of red blood cells or production of erythrocytes. Very simple. That's the erythropoiesis. And the red blood cells originate from hemopoietic stem cells called proerythroblast. Okay? So pro indicates one stage earlier, before. Okay? So erythro indicates red blood cells, and blast, you all know, blasts are mature or immature cells. Cytes, what's the difference between cyte and blast? I have talked about that earlier. Blasts are immature and cytes are mature. So pro-erythroblast. That means before the premature red blood cells. Make sense? Erythroblasts are immature red blood cells, and pro indicates before that. So even before the immature red blood cells, those are the stem cells of red blood cells. Site of formation. During early life, red blood cells are formed in the liver and red bone marrow. So those are the two main sites of production of red blood cells in early life. And in adults, liver doesn't produce red blood cells anymore, only the bone marrow produces the red blood cells. So in early life, both liver and red bone marrow, and in adults, late life, only the red bone marrow produces the red blood cells. Factors influence erythropoiesis. That means, what are the things that will stimulate the bone marrow to produce more red blood cells? We know that bone marrow produces red blood cells. So what are the things that will stimulate the bone marrow to produce more red blood cells? One is renal erythropoietin, a chemical. Renal means what? Kidney. And erythro means what? Red blood cells, right? Erythrocytes. And poietin indicates poiesis, production. So the chemical that is produced in the kidney and that stimulates the production of red blood cell, that is renal erythropoietin. Okay? So that is one chemical that will tell the bone marrow to produce more red blood cells. Testosterone I have already mentioned, right? Why male body, in male blood the red blood cell count is more? Because of the presence of male sex hormone testosterone. And another is hypoxia. If you climb on the top of high mountain and stay there for a few hours, you will see that the red blood cell number has increased in your blood. Okay? The reason is, on the top of the mountain, the oxygen is less, right? So your body will respond to that by producing more red blood cells, because now your blood has to carry more oxygen. Your red blood cells has to carry more oxygen from small amount of oxygen. It should be able to carry same amount of oxygen, because your body needs the oxygen, right? So how our body can do that? By increasing the number of red blood cells. That is one way your body will be able to carry same amount of oxygen that you need for your survival, right? So those are the three factors that stimulate the erythropoiesis or production of red blood cells. Maturation of red blood cells. So after the red blood cells are formed from the stem cells, three important changes take place during the maturation of red blood cell. One is reduction of cell size. Please change this one. This is Z, not T. Cell size. The size of the cells will get smaller. Okay. So reduction of cell size. Number two, appearance of hemoglobin. Hemoglobin will be synthesized, will be produced inside the red blood cells. And number three, disappearance of the nucleus. So as John, you asked, right, that is the immature red blood cells or young red blood cells have nucleus or not? Yes. In early stages, the red blood cells have nucleus. Okay, but when the red blood cells will get mature, gradually the nucleus will get smaller and eventually will be thrown out, will be ejected, okay, from the cell. So those are the three changes. Number one, I am repeating again. Initially, the size of the red blood cell is big and has a large nucleus. The red blood cell size will gradually shrink, will get smaller. The hemoglobin production will start, so hemoglobin synthesis will occur, and the nucleus will shrink and get very small and will be thrown out. Ejection of nucleus will occur. Those are the three important changes. Remember, very important for your test. I may ask you. Okay, so here in this picture, you see those three changes during the maturation. So we know that the stem cells are called pro-erythroblast. We have talked about that. So this is the pro-erythroblast. You see a large nucleus inside. The cell is pretty big. Then the cell will enter into the blood from the bone marrow. It will enter into the blood. Still it is inside the bone marrow. And what will happen? The cell will gradually shrink. Will get smaller, and will get smaller. And you see here, you can see the synthesis of hemoglobin has occurred. So you can see the dots. These are the hemoglobin, and nucleus got smaller and got ejected or thrown out from the cell. And then finally, the mature red blood cell will enter into the blood. Here is the blood. Okay, entering into the circulation. That means into the blood. Okay, so all these changes will occur in the bone marrow. Here. So these are the name of those phases. First is pro-erythroblast, then erythroblast. Blast is premature cell or young cell. Then polychromatophilic erythroblast, normoblast, reticulocyte, and then mature red blood cell, which doesn't have the nucleus, okay, but hemoglobin is there. Now, you don't really, I won't expect that you remember all those names, but what I would expect from you, that if I ask you what are the important changes occur during the maturation of red blood cells, three important changes, what are those? Shrinks, reduction of cell size, yes, ejection of nucleus, and synthesis of hemoglobin, appearance of hemoglobin, disappearance of nucleus. Very good. Those three changes. Okay. Let me, although I said you don't need to remember all those names, let me just a little bit explain. So pro-erythroblast, erythroblasts are immature cells, and pro means even before. So that's a very early stage. Then erythroblasts, next stage is erythroblast, young red blood cell. Then polychromatophilic erythroblast. Poly means many, multiple. Chromatophilic, philia means attraction, right? And chromato indicates color. So in this stage, the young red blood cells will be stained or can be stained with multiple color. Okay? So polychromatophilic erythroblast, then polychromatophilic, then normoblast. Normo indicates normal. Why it is called normoblast? The size of red blood cell is now very close to the size of normal mature red blood cells. So it has already got the normal size of red blood cell, mature red blood cell. That's why it is normoblast. And then next stage is reticulocyte. In this stage, just remember that just after the ejection of nucleus, just after the nucleus gets out, that stage is the reticulocyte, and that is just before the erythrocyte or red blood cell, mature red blood cell. Okay. Distribution of red blood cells. Sorry, destruction of red blood cells. I have mentioned before that the lifespan of red blood cell is 90 to 120 days. That means 3 to 4 months. After 3 to 4 months, the red blood cells will be destroyed in our body. And why the lifespan of red blood cell is short? only 90 to 120 days. The reason is, you know, that red blood cells don't have any nucleus, right? Don't have any nucleated. And we know that nucleus is the control center of the cell, right? Nucleus is the main component of the cell. It is called the control center of the cell. Since there is no control center, right? So if it is very difficult for the red blood cell to survive. There is no mitochondria. Mitochondria is called what? The powerhouse, right? Mitochondria produces ATP. You know that. ATP is, or energy is produced by mitochondria of the cell. So since there is no mitochondria, the cell doesn't get enough energy. So the cell membrane gets very weak gradually, and eventually the destruction or rupture of the cell will occur, okay, because of the weakness of the cell membrane. Okay. The cells will usually die when the red blood cells will try to pass through narrow capillaries, because after 90 to 120 days the cell membrane becomes very fragile, very weak, so easily will get destroyed. Okay, and main sites of destruction of red blood cells are spleen and liver. In those two organs, most of the red blood cells will be destroyed. And that's why those two organs are called the graveyards. Those two organs are called what? Graveyards of red blood cells. They go there and then get destroyed like that. Okay? And there are a lot of macrophages in this liver and the spleen, and the macrophages, they will engulf the red blood cells and destroyed parts of the red blood cells. Hemoglobin. We know that the main structure inside the red blood cell is the hemoglobin. And hemoglobin is the red pigments, and that gives the color of the blood. And the function of hemoglobin is transportation of oxygen and carbon dioxide. Hemoglobin can easily get attached and detached. That means reversibly can get attached. It can get attached and also can release easily. So it can easily get attached and also easily can release the oxygen and carbon dioxide. That's why the hemoglobin is good to carry oxygen and carbon dioxide. The concentration of hemoglobin in normal, the concentration of hemoglobin in adult male is 14 to 18 gram per deciliter of blood. So, in 100 milliliter of blood or 1 deciliter of blood, the concentration of hemoglobin is 14 to 18 gram. In adult female, it is less, 12 to 16 gram per deciliter or 100 milliliter of blood. The reason you already know, like if you take 100 milliliter of blood from an adult male and adult female, in which one the red blood cell number is more? Adult male, right? Adult male blood will have more red blood cells here. This is female, less red blood cells, right? Now if you take all red blood cells out from here, in 100 milliliter, take all red blood cells out from here, from female blood, then the number of red blood cells is more here, so the amount of hemoglobin should be more here. That's simple, right? Okay. So that's why the amount of hemoglobin is more in male because of the number of red blood cells. Okay, the structure of hemoglobin. Hemoglobin, one molecule of hemoglobin, you can see a single molecule of hemoglobin, you will see 4 heme components. These are heme, and this is globulin, and globulin is formed by 4 chains, 2 alpha and 2 beta. Alpha 1, alpha 2, beta 1 and beta 2. So 4 heme components and 1 globulin, but that globulin is the protein part or globin that has 4 chains, 2 alpha, 2 beta. So that's the structure of hemoglobin. 4 heme and 1 globin. So hemoglobin, but that globin has how many chains? 4 chains. 2 alpha, 2 beta. And the main component of the heme is the iron. You see inside the heme, this is the iron, Fe. And iron, heme contains iron in the center, and that iron should be present in ferrous form, Fe2+, that means ferrous. I think FeRUS, right? Whatever. Just know that in ferrous form, and that form is very important because ferrous form iron, Fe++, that form of iron can easily get attached to the oxygen. If the iron, remember, is in ferric form, 3+, that is called ferric, the iron is not able to get attached to the oxygen. Okay? So, which forms iron is can easily get attached to the oxygen? Ferrous form. Okay? That's why in the hemoglobin the iron is present in ferrous form. I may ask this in the test, so remember that it's not in the slide here. Okay, now so here oxyhemoglobin. When hemoglobin gets attached to the oxygen, that form or that status is called oxyhemoglobin. Very easy. And oxyhemoglobin is bright red color. When oxygen gets attached to the hemoglobin, that oxyhemoglobin is bright red color. That's why arterial blood is bright red. We have talked about that, right? When hemoglobin gets attached to the carbon dioxide, that is called carbaminohemoglobin. Okay? Carbaminohemoglobin. Okay, now we will see what happens after the red blood cells are destroyed. What happens to hemoglobin? We know that inside the red blood cells we have hemoglobin, and when the red blood cells will be destroyed after 90 to 120 days, then what will happen? So if you follow this picture, this is a nice picture. A little bit complicated, but if you see a couple of times, it will get clear to you. So, this is a bone, and we know that in the bone marrow, the red blood cells are produced, right? The production of red blood cell occurs in the bone marrow. So, after the production of red blood cells will enter into what? Into the cell, yeah, you're right. Blood, right? Into circulation. So you see here, red blood cell is entering into the blood. This is the blood, okay, blood, and then it will stay in the blood 90 to 120 days, right? It will perform its function, and after that, the red blood cell will get very weak. The cell membrane will get very weak and fragile, and 10% hemolysis, that means the breakdown of red blood cell, will occur inside the blood. Okay? Since the blood always moves, right? and the cell membrane is very weak, so 10% of red blood cells will be destroyed because of that flow of the blood inside the blood. And 90% of red blood cells will enter into the graveyards. And we know the graveyards are liver and the spleen. Okay? So the red blood cells will be destroyed in those two organs. Now, red blood cell has the hemoglobin, and hemoglobin has two components, right? What are the two components? Hem and globin, right? Now, those two components will get separated. So here you see the hemoglobin, this red dot, hemoglobin will get separated into heme and amino acids. Now, amino acids are nothing but globulin, because globin is protein part. Globin is protein, right? Alpha chain, beta chain, those are amino acid chains, and we know that amino acid chains form the protein. So globin or amino acids, same thing. Okay? So the amino acid chains and the amino acids will get separated. So the amino acids will do what? The amino acids will go back to the bone marrow to produce new red blood cells. Okay? So they will be recycled, reused. And heme part, what happens to heme part? Heme will release the iron. You know that inside the heme, the iron is in ferrous form, right? Iron is inside the heme. So iron will get detached from the heme and will do what? Will go back to the bone marrow to produce new red blood cells. So nice, right? So the globin, that means the amino acids, will go back to the bone marrow. The iron of heme will go back to the bone marrow. Now, the rest part of heme will be converted to a chemical that is called biliverdin. Okay, so the rest part of heme will be converted to biliverdin, and then biliverdin will be converted to yellow pigments. You all know that. That is the bilirubin. You know bilirubin, right?
Can you write what it's converted to? So
Biliverdin. So biliverdin, and then biliverdin will be converted to yellow pigments. The yellow pigments are bilirubin. You know that, right? Have you heard bilirubin? How many of you have heard bilirubin? How many of you have heard bilirubin? Bilirubin is here. You know jaundice? Jaundice? How many of you know jaundice? You don't know jaundice? Okay. Again, show me how many of you know jaundice. I need to know that. Okay. So you don't know. How about you? You know jaundice? Okay. So have you seen the clinical condition in which the color of the skin gets yellow? Yellow color. Have you seen? Sometimes in fetus, after the baby is born, the color. What do you say that? Never heard yellow? Oh, that's.
Can it be caused by drinking a lot too? People that drink a lot get jaundice.
The doctor suggests to drink a lot.
Yellow, kind of.
Yeah, yellow coloration of mucous membrane and eyes and skin. Okay, so jaundice occurs due to why jaundice occurs due to increased level of bilirubin in the blood. This is very common clinical condition. So the level bilirubin is yellow pigment. So if that amount of yellow pigment in your body increases, the color of the skin, your eye, mucous membrane will be yellowish, right? And that is the normal. So I'm repeating again quickly. The red blood cells will be produced in the bone marrow, will enter into the blood, and after 90 to 120 days, the red blood cells will be destroyed. 10% of red blood cells will be destroyed in the circulation in the blood, and the rest red blood cells will be destroyed in the graveyards. Okay? spleen and liver. And what will happen after the red blood cells are destroyed? Hemoglobin will come out, and hemoglobin has two components, heme and globin. And heme contains iron, right? The main component is the iron, and globin is protein formed by amino acids, right? So the globin will release the amino acids, and heme will release the iron. So iron will come back to the bone marrow, amino acids will come back to the bone marrow to do what? To produce new red blood cells, right? So those two things will go back. Now, the rest part of heme will do what? Will be converted to what? Biliverdin. And biliverdin will be converted to bilirubin, which is what? Yellow pigments, right? And that bilirubin will form bile. You know that bile is stored in the gallbladder, that liquid. Have you heard bile? Okay, so that liquid, that is heavily, bilirubin is present in high concentration in the bile. So the bilirubin will produce bile, and then that will come to the small intestine. The bile will enter into the small intestine, and bile is very important for what? Digestion of fats. Okay, so that's why the bile should be stored in the gallbladder, and when you eat fat-rich food, your intestine will need bile, right, to do the digestion of fat. So from the gallbladder, the bile will enter into your intestine, small intestine. Okay, and we eat fat all the time, and that's why bile is released into the small intestine all the time, right? And that's why the color of the feces is yellow, because of the presence of bile. Okay, so and continuously red blood cells are dying in our body, right? So bilirubin is being formed, bile is being formed, and that's why yellow. And small amount of bilirubin will go to the kidneys and will get out from the body with urine. And that's why you see the color of the urine is what? Slightly yellowish, straw, slightly yellowish color. Why? Because of the presence of bile. That bile comes from the destruction of red blood cells. Okay? So, small amount of bile will enter into the kidneys and will get out from the body as urine. Most of the bile will enter into the intestine and will get out with the feces. Yes.
When someone becomes highly dehydrated, don't they eventually start vomiting bile?
Second.
When someone gets highly dehydrated, and they've been vomiting or whatever, don't they eventually start to vomit bile?
Yeah. In that condition, what happens? The concentration, bile is already present in your intestine, right? Because bile is being continuously released. But in dehydration, what happens? Your body needs water, right? Because your body doesn't have enough water, so it will absorb most of the water from your intestine as much as it can. Okay, and the concentration of fluid inside the intestine will be high, and that's why when you vomit, you see the concentrated fluid that has a lot of bile in it. But actually, the amount is not increasing there, but the water has been taken out. So when you vomit, you see more concentrated bile there. Okay. Okay. Couple of clinical conditions. One is called hemoglobinuria. Hemoglobinuria is the condition in which hemoglobin breakdown products will be found in the urine due to excessive hemolysis. Hemolysis means the breakdown of red blood cells. So if we know that normally some red blood cells are continuously dying in our body. Those red blood cells are getting, their age 90 to 120 days, they're dying, right? So continuously some red blood cells are dying. Now, if due to some reason the excessive destruction of red blood cells occur, excessive hemolysis takes place, in that case you will find the hemoglobin breakdown product in the urine, and that is called hemoglobinuria. Another condition, hematuria. If you see the whole red blood cells in the urine intact, okay, intact red blood cells, if they are found in the urine, that is not normal, right? Red blood cells should not be found in the urine. So in that case, that condition is called hematuria. And it is very easy to diagnose, because if you take a drop of urine and see under the microscope, you know how the red blood cells look like, right? Intact red blood cells. So you will see the red blood cells are present in the urine. And why that happens? One reason is any injury in your urinary system, anywhere. If any injury occurs, then bleeding will occur, right? So blood will get mixed with the urine, and you will see that. Another reason is kidney filters the blood, we know that, right? And there are many tiny holes in the filter, we know that, like filter paper, right? And if for some reason the kidney is not functioning normally, those holes will get bigger, may get bigger, so the whole red blood cell can pass through, okay? So can enter into the urine, that is hematuria. So you have to eventually figure out what's the reason. Is it due to injury of anywhere in your urinary bladder? If any injury occurs, then the blood will get mixed with the urine, right? Because that is not related to the kidney. But if filter has problem, whole red blood cell can get out through those holes. That is a big problem in the kidney, right? Because kidney failure may occur. Okay. So now we'll start the last section of blood. So we are talking about the blood cells or formed elements, and we are talking about the red blood cells. We'll continue to talk about red blood cells first. Erythrocyte disorders. What could be the abnormalities or clinical conditions related to the red blood cells? One clinical condition that is very commonly heard, that is called anemia. You all probably know that, anemia. So that is related to the red blood cells or hemoglobin inside the red blood cells. We'll talk about the anemia first. What are the different types of anemia? Then we'll talk about the white blood cells, important properties of white blood cells. Then we'll talk about different types of white blood cells. You know that there are 5 different types of white blood cells, right? Neutrophils, eosinophils, basophils, lymphocytes, and monocytes. I have mentioned that in last class. So we'll talk about those 5 different types of white blood cells or lymphocytes. Then we'll talk about thrombocytes. Thrombocytes are platelets. Another name of platelets is thrombocytes. So we'll talk about the platelets, important properties and functions. And then we'll talk about the coagulation of blood. Coagulation is what? The process by which the liquid blood is converted to semi-solid jelly-like clot. So the process of formation of clot, right? That is what? Coagulation. So we'll see how the coagulation occurs or takes place. Then we'll talk about blood types and complications related to mismatched blood transfusion. That means what? If my blood group is A and your is B, if I give blood to you, that is not matched blood, right? Transfusion. So that is called mismatched blood transfusion, and what complications can occur due to that. Okay, so those are the things we will talk. So anemia is the condition in which blood has abnormally low oxygen carrying capacity. We know that the red blood cells of blood carry the oxygen. Which part of red blood cells? The hemoglobin, right? Carries oxygen. So if the blood cannot transport enough oxygen, that condition is called anemia. And we know that oxygen is required for metabolism. We all know that. So in that case, what will happen? The blood will not be able to supply enough oxygen to the tissues for adequate metabolism, required metabolism in our body. And some symptoms of anemia includes extreme tiredness, fatigue, paleness, the whitish color of your skin and mucous membrane. And you know that if you complain that you are feeling weak and tired and go to the doctor, they will check your mucous membrane, right? Your nail bed to see if, because in those locations you can see the blood circulation better. Like if you press the nail here and blade, you will see the blood is getting in, right? So by looking the color of those locations particularly, you can see the color of the blood. In anemia, the color will become less red, that is paleness, shortness of breath, and chills. So the person will feel kind of cold, and the breathing, shortness will feel shortness of breathing. Those are the common symptoms of anemia. So if you see those, you should test the person, test the blood if that person has anemia. So one type of anemia that is due to insufficient erythrocytes. Now, why the anemia can occur? Two simple reasons. One is, like if this is your blood and this is the person who has anemia. So this is normal person, and this is anemic person. Okay, so this is anemic blood. Now, you see here, just example, like if in your blood there are these many red blood cells. These are red blood cells in your blood, normal, right? And in patient's blood, there are less number of red blood cells, right? So which blood will be able to carry more oxygen? This one, very simple, right? So this is anemia due to what? Insufficient red blood cells, decreased number of red blood cells, right? So that is one reason. Now see, same number of red blood cells, right? In your blood and patient's blood, but still this blood may not carry enough oxygen if the amount of hemoglobin in your blood cells, red blood cells, is more. Which one will be able to carry more oxygen? This one, right? Because of more hemoglobin. Hemoglobin is the main, hemoglobin carries oxygen, right? Is the main component. So now you see that anemia could occur due to two reasons. One is decreased number of red blood cells that I have shown you first. Another is even the number of red blood cells is normal, but decreased amount of hemoglobin. Okay. So if you see someone is complaining those things and take his blood and see under the microscope and count the red blood cell only and see the count of red blood cell is normal, would you be sure that he doesn't have anemia. No, because you have to see the amount of hemoglobin too, right? Sometimes number could be same, but the hemoglobin amount could be less, right? So not only counting the number will tell you the person doesn't have anemia. Make sense? So insufficient red blood cells is one reason of anemia. And why the red blood cells, or how the red blood cell count can go down? One is hemorrhage. Hemorrhage is loss of blood. So if someone loses blood from the body, that is called hemorrhagic anemia. And hemorrhage can occur due to acute or chronic loss of blood. What is the example of acute? Acute means instant, quick, acute loss. So how acute loss of blood can occur? Injury, big injury, right? Serious injury, if you get a big cut, loss of a lot of blood will quickly get out from the body, right? So the red blood cell count will go down in your body. Surgery, big surgeries, right? Lot of blood loss occurs. So those are acute hemorrhages, and that can cause anemia. Chronic blood loss. Give me an example of chronic blood loss. Ulcers, very good. You know, if you have ulcer in your stomach or intestine, small amount of blood will always leak, will get out from the body. But eventually, prolonged, if continuously blood gets out, although small amount, then your body will have less red blood cells. Another example, menstruation. Irregular menstruation. If someone's menstruation in female, usually in females, what happens? Excessive loss of blood if occurs due to menstruation, that can lead to anemia. Okay. So those are chronic loss of blood. Hemolytic anemia. Hemolysis means the destruction of red blood cells. So if in someone's body, we know that normal destruction is always occurring in the body, right? Red blood cells are normally, some red blood cells are dying because they are getting old. Now, if excessive destruction or hemolysis occurs, the red blood cells die prematurely, even before 90 days. If they die, then anemia can occur. Aplastic anemia, due to destruction or inhibition of red bone marrow. We know that the site of production of red blood cells is the bone marrow. Now, if the destruction of bone marrow occurs, the number of production will be less. Make sense? Now, the depression of red bone marrow or destruction of red bone marrow can occur due to some chemicals or radiation. Those are main two causes. One is some drugs, chemicals, okay? If you take, that can cause destruction of red bone marrow, or at least inhibit the red bone marrow to produce the red blood cells. So, due to drugs or chemicals, destruction can occur or inhibition can occur. Another reason is what? Excessive radiation. Excessive radiation can depress the bone marrow or destroy the bone marrow. So those are aplastic anemia. So those three belong to decreased number of erythrocytes. Another is low content hemoglobin. If the hemoglobin amount is less, then that is also anemia. And the production of hemoglobin can be less due to decreased amount of iron in the body. If the iron is less, that is called iron deficiency anemia, because we know that heme part of hemoglobin needs iron, right? The heme needs iron. So if someone has less iron, the synthesis of hemoglobin will be less and oxygen carrying capacity will be less. Another, that is called iron deficiency anemia. Another is pernicious anemia. And what is that? The pernicious anemia is the anemia that occurs due to the lack of vitamin B12. And vitamin B12 is also important for the synthesis of hemoglobin, production of hemoglobin. So if someone doesn't have enough vitamin B12, then the synthesis of production of hemoglobin will be less. And that is called pernicious anemia. Okay? And another type of anemia that is called abnormal hemoglobin content anemia due to abnormal hemoglobin. Now you see that what happens, what can happen. The amount of hemoglobin in this patient's blood, the number of red blood cell is normal, the amount of hemoglobin is normal, right, in patient's blood. But what can happen? The shape of the red blood cell or the shape of hemoglobin, both, can be changed. Like amount of hemoglobin is same, but the shape is not right. Either the shape of hemoglobin or shape of red blood cell, that is not right. So in this case, the hemoglobin will not be able to carry oxygen because it doesn't have correct structure. Although the amount is same, right? But the structure is not right, correct to get attached to the oxygen. Okay. So that is abnormal hemoglobin content anemia. One is called thalassemia, and another condition that is called sickle cell anemia. Okay. Thalassemia occurs due to faulty globin part of hemoglobin. We know that hemoglobin has two parts, heme and globin. If the globin part is faulty, not structure is not right, then that will lead to thalassemia. Okay. Globin is what? Globin is what? Protein or fat? Protein, right? You all know that. And protein is formed by what type of chains? Amino acid chains. Very good. Now, this globin is protein which is formed by amino acid chains. We know that, alpha, beta chains. Now, in amino acid chain, these amino acids, there are different types of amino acids. Okay? And they must be sequenced in right order. Make sense? Like which one will come after which? They must be sequenced in right order. If the sequence changes, if this one goes there, this one comes here, that globin is not good. That globin is not be able to perform the task. Make sense? So abnormal globin will occur due to abnormal chain, amino acid chain. That will lead thalassemia. And sickle cell anemia, it is a genetic disorder and happens more in African, black African people, and they suffer from sickle cell anemia more. Why? You see again, this is the amino acid chain. Valine, histidine, leucine, threonine, those amino acids will should be sequenced correctly. In sickle cell anemia, what happens? The glutamate is replaced by glutamine is replaced by valine. Just in one location, right? You see here, so small chains. One amino acid is replaced by another one, and that will lead to the change of the shape of hemoglobin. Instead of round, it will become like sickle. Have you seen sickle? Sickle is the knife-like thing the farmers used to use long time ago to cut the part. Yeah. So the shape of hemoglobin will be like sickle. Okay. That is, and not only that, the hemoglobin usually is soft. Okay. But in sickle cell anemia, when the glutamine will be replaced by valine, the shape will be changed as well as the hemoglobin will become very hard like crystal. So that hemoglobin is not good to get attached to the oxygen. Okay? So this is another abnormal hemoglobin anemia. Yes.
Someone who carries the trait but doesn't actually have a full-blown disease, do they still have like half and half, some cells are sickle and the rest are?
Not all. Usually you see mixed. Some cells are normal, some are sickle cell. But you'll see many. And that is really life-threatening, right? Because we need the red blood cells. If the red blood cells are abnormal, fixing the genetic problem is almost impossible. We are not still way behind to fix the genetic problems. So it is very dangerous clinical condition.
Is it just formed that way right off the bat, or is it a result of it getting broken apart and repairs itself?
You know that the inside the cell, the synthesis of protein occurs, right? Ribosomes get signal from the nucleus control center. Control center will send signal, messenger RNA to the ribosomes to sequence. Okay, it's like factory, putting one after another in right sequence. And when the synthesis of protein will occur, the globin, that time it will put in wrong place.
So it's just right off the bat.
Yeah. The problem is inside the nucleus of the cell. Okay. So, anemia is one type of clinical condition related to the red blood cell. Another is polycythemia. Polycythemia is opposite, increased number of red blood cells, excessive production of red blood cells. Okay, so that is called polycythemia, and there are two types of polycythemia. One is called polycythemia vera, that is also called physiological polycythemia. Okay. Sorry, the polycythemia vera is not physiological. The secondary polycythemia is also called physiological polycythemia. The reason is secondary polycythemia is the condition that can be reversed. Like I told you before, if you go on the top of high mountain, what will happen? The red blood cell count will increase, right? And when it will come down, again it will come back to normal, right? So this is just the change of physiology. That's normal response. Normal means physiology. Normal response of your body function. So that is secondary polycythemia. Now, polycythemia vera is the clinical condition, and in which the red blood cell count increases due to bone marrow cancer or tumor. If that occurs, the bone marrow will produce more cells, abnormal but more cells, and that red blood cell will come into circulation, and the number of red blood cell count will increase, right? If bone marrow cancer occurs, cancer is what? Abnormal multiplication of cell, right? So that will release more red blood cells into the blood. And that is, now what's the problem of polycythemia? If the blood has really high number of red blood cells, the thickness of blood will go up, right? The water portion, plasma portion, the ratio of plasma portion will go down. Make sense? The formed elements will be more than. So the blood will be really thick, and thick blood will not be able to circulate in normal flow. This is simple, right? If it is thin, it will circulate easily. If it is thick, it will not flow in normal velocity, right? Normal speed. And that is one problem. If blood cannot circulate enough in your body, then your body will not cannot get enough oxygen, right? Or other things. So circulatory overload will occur. So another type of polycythemia, although this is not really polycythemia, that is called blood doping. Have you heard that? I think many of you have heard. Those are interested in about athletic things.
Boxers, blood dope, right?
Blood dope. So what we sometimes athletes do, they take their red blood cells out from the body and preserve. It is not difficult. You can put in the refrigerator and preserve the red blood cells there. And just before the event, you will take the red blood cell and inject into your body. So what will happen? The red blood cell count will increase, right? So your body will be able to carry more oxygen. And athletes need more oxygen. More oxygen means you can perform better, right? So those athletes, it is actually not allowed, right?
Obviously, yeah, you can't, you're not supposed to do it.
You are not supposed to do that. Okay? So don't try to do that. Okay? So that is just induced polycythemia. You are injecting red blood cells into your body. Okay, so let's stop here.